Hello there, my name's James Dyer. I'm a consultant urologist here at Stepping Hill with a specialist interest in treating patients with bladder cancer, and we're providing today a video for your information in regard to a radical cystectomy. So a radical cystectomy is surgical removal of your urinary bladder. Normally, your urinary bladder can do two things. It can either store urine and fill up, or it can expel urine by contracting. Most people who undergo a radical cystectomy either have this because they have bladder cancer which has invaded the muscle that surrounds the bladder, or they have non-invasive bladder cancer that has a high risk of developing that in the future. After a cystectomy, you will either have a stoma, which collects your urine via a portion of your bowel and sits on the skin in the right-hand corner of your abdomen, or formation of a new bladder called a neobladder. Typically, we perform this operation using a keyhole approach and a surgical robot, which we'll talk about later. And in men, this would involve 6 small cuts around 1 centimetre in size in your abdomen, alongside a slightly larger cut 2 to 3 inches in size to remove the specimen, and the stoma would sit in the bottom right hand corner of your abdomen. In women, we just have 6 small cuts in the abdomen about 1 centimetre in size, and the specimen is removed through the vagina. There are some alternative treatments in certain circumstances, and these should have been discussed with you previously. These can include radiation therapy to the bladder or immunotherapy or BCG into your bladder. So you're probably thinking how or what the prelude to your surgery will be, and for everybody this should include a detailed pre-operative assessment whereby your medical history is reviewed, some basic tests are done, and the decision whether you need any specialised testing to see whether there's anything that can be done to improve your overall medical fitness prior to your surgery. You will also see the stoma nurses, and they will be very important to your treatment. They will site where your stoma will fit if that's what you're going to need. There are certain considerations that the stoma team will discuss in this video and should discuss with you in person as well. In terms of nutrition leading up to surgery, you'll be given some very detailed and specific advice which will cover the last time that you can eat anything solid and the last time you can drink any fluids prior to your operation. With regard to the procedure for admission to hospital, most patients are admitted at 7 o'clock on the day of surgery, and on the morning of your operation you'll be again reviewed by your surgeon, by the consultant anaesthetist. You'll be reviewed by the pharmacist to ensure your regular medications are all understood and prescribed, and you'll also see the enhanced recovery team, who will also feature later on in this video. There are certain circumstances where you may be asked to be admitted the night before surgery, but most people come in on the day of the operation. In regard to the operation itself, so the operation is performed under a general anaesthetic. Typically it takes between 4 and 6 hours. As I've mentioned previously, we use the surgical robot to perform it. There are specific things that your anaesthetist will talk to you about afterwards in terms of post-operative pain relief, and often this is done with a patient-controlled system, administering small amounts of strong pain relief to ensure that you're able to move and cough and so forth after your surgery. So here at Stockport, the vast majority of cystectomies are performed using the Da Vinci surgical robot. This allows us to use smaller incisions, enhanced surgical precision, which has, in our experience, been shown to reduce the chance of blood transfusion and minimise your length of stay and increase the function or optimise the functional outcomes after surgery. Typically, the operation lasts between 4 and 6 hours. When the operation is finished, if you're having a stoma, that will be in place. You'll also have an abdominal drain, which is a plastic tube which prevents any collections forming on the inside of your abdomen. This is usually removed 2 to 3 days after surgery. You'll have some metallic skin clips at the wounds, and again these are removed after about 10 days. To protect some of the joins that we have to make as part of the surgery, you'll also have some stents in your stoma, in your urostomy, and these are typically removed 7 to 10 days after the operation. It's often the case that you will have gone home prior to this and you'll be brought back specifically for that appointment. Most patients after surgery are admitted to the high dependency unit, usually for 1 or 2 days. This process allows us to monitor things closely. One of the complications of surgery such as this is leaks from the joins between either your bowel and your ureters. This is thankfully a very rare complication, and if it were to happen, it's something that usually requires either emergency surgery or drains, and so being on the high dependency unit allows us to monitor and act upon that quickly. So after you're discharged from the high dependency unit, you will then go to the surgical ward, and given your total length of stay should be somewhere between 7 and 10 days, the majority of the time will be on the surgical ward. At that time, you can expect at least a daily review by the medical team, and often this is your consultant. You'll be seen by the enhanced recovery team, and you'll also be nursed on the ward, getting you to that process where you're able to look after your stoma independently and comfortable enough to go home. We expect that you'll be eating and drinking well, and your bowels will have opened before you are discharged from hospital. A radical cystectomy is a major operation, and it does carry with it some risks. Some of the risks are more frequent than others. More commonly occurring risks include bleeding, requirement of a blood transfusion, infections, and you're given intravenous antibiotics to mitigate this, but infections can occur in your chest, your urine, or inside your abdomen. Blood clots developing on the legs or on the lungs, called venous thromboembolism, is also a risk, and you'll be given injections under the skin to be administered once a day for 28 days, so whilst you're in hospital and after discharge, to help reduce that risk. In the longer term after such surgery, the stoma can very occasionally narrow down and compromise your kidney function, and you can also develop hernias at the site of your stoma. These are things that are correctable and will be monitored in the post-operative course. One of the most common problems after a radical cystectomy is return to normal bowel function. In between 1/3 and a half of patients, you may develop vomiting afterwards, which usually occurs 2 or 3 days after the operation, and this is because we've had to manipulate your bowel on the inside of your abdomen, and as a result of that your bowel is no longer propelling food and fluid through in the usual way. The way that this is usually managed is either with a liquid drink which can help propel food through, or with a tube which is sighted down the nose into the stomach to drain the stomach, and usually this is all that's required for it. If there is what we would call a prolonged ileus, then this may be investigated with a CT scan whilst you're in hospital. There are certain things that can reduce the chance of a post-operative ileus. First and foremost, using the surgical robot has helped us to do that. It's crucial that you get up and about and walking. That can help. We will ask you to bring some peppermint tea in with you, which can help in this situation, and also chewing gum has been shown to help the bowel recover function quickly. In following a radical cystectomy, because of the removal of the prostate gland and the seminal vesicles, all men are infertile at that stage. We, again, using the surgical robot, can try and preserve erections as much as possible, but some men may find that their erections are no longer present after surgery. For men who may find their erections are worse after a radical cystectomy, this can be treated with injections into the penis or creams administered to the penis to induce an erection, and we can also make sure that you're reviewed in our andrology clinic to help you through this process. In women, sometimes is the requirement to remove part of the vagina, which can leave the vagina short and have an impact on sexual function. However, there's lots of circumstances where we can spare the whole vagina, and hopefully sexual function is preserved as much as possible. So following your cystectomy, it's routine for us to perform CT scans to monitor for any recurrences of cancer. These are typically performed at 6 months after your surgery, 1 year after your surgery, and then annually thereafter, usually for a period of 5 years. There are circumstances where that might be extended. Additionally, we'd also routinely perform some scans to observe the drainage of your kidneys, and these are typically done between 6 and 12 months after your operation, and then another year later on. So your Your first routine post-operative review would usually take place at around 6 weeks' time, and at that stage we can go through the specimen that's been removed and whether that requires any further treatment or not. Prior to that, we would advise that you don't drive or undertake any heavy lifting or heavy duties, and then at that 6-week review, whether that continues or not can be assessed. By 3 months, we would expect most people to get back to the sorts of activities they were doing beforehand. It's important to be aware, though, that if you don't feel well or don't feel right, you contact your specialist nurse and we can get you in for a review prior to that 6-week appointment.
Hello, my name is Mandy Bellini. I'm one of the urology specialist nurses here at Stepping Hill, and I work closely with the consultant urologist that will be doing your surgery to help and guide you through the journey that you'll be going through, and also keeping in contact with you after your surgery when you go home. We try to reduce the risk of you developing a clot by early mobilisation after surgery, which has been mentioned previously. We encourage you to mobilise as soon and as much as you are guided to. We use compression stockings on your lower legs. You'll be given an injection after your surgery. It's called Clexane. It's a blood thinner. It's given into your tummy. It's a very small needle and very easy to insert, and patients find it very comfortable to have administered. And when you leave to go home, you'll be instructed how to do this yourself and take home the needles with you, and a bin provided to put the needles into once you've administered your drug into your tummy. Okay, one of the things you will have when you wake up after your surgery is a drain into your abdomen. This will drain any fluid and blood from the wound site. The drain is usually removed before you go home. It's held in place with one stitch, which is removed, and then gentle pressure applied to pull the drain out. And most patients find this a relatively comfortable procedure to undergo. It's very quick. On rare occasions, you will go home with your drain in and return at a later date to have it removed. The wounds that you will notice after your surgery are closed with metal clips and covered with a dressing which is waterproof. You will be encouraged to shower regularly after your surgery. You can replace the dressing, and they are waterproof, but you're encouraged to keep the wound clean and dry. You may notice some slight leakage of fluid around the wound, and that is entirely normal, but if you're concerned, then we would encourage you to let your surgical team know if you're still an inpatient, if you've gone home, to contact the specialist nursing team and they can discuss this with you. Prior to your surgery, you will have been given quite a lot of written information that you'll take home with you, and that has some useful resources that you'll be able to access following surgery. When you return home from your surgery, we would encourage you to contact your specialist nursing team at any time if you are concerned or have worries. Please don't hesitate to get in touch with us and we can speak to your consultant very quickly.
Hello, my name is Becky and I'm the Enhanced Recovery After Surgery nurse here at Stepping Hill Hospital. The ERAS Plus programme aims at helping you prepare for major abdominal surgery and helps you recover sooner, aiming to reduce the length of time you spend in hospital. ERAS Plus starts before you have your operation, focusing on getting active, chest training and good nutrition. As part of ERAS Plus, you'll be invited to surgery school. Surgery school is an important opportunity for you to ask any questions you have regarding your surgery and to know what to expect when you come into hospital. We also focus on getting active before your surgery and allowing you to take an active role in your recovery, again trying to reduce the time you spend in hospital and allowing you to return home sooner to recover. At surgery school, you will speak to myself, a consultant anaesthetist, members of the acute pain team and members of the physiotherapy team. We focus on getting active before surgery and all the things you can do to help you get home sooner. As part of ERAS Plus, we use the ICOF UK bundle. ICOF UK stands for Incentive Spirometry, Coughing, Good Oral Health, Understanding, Getting Out of Bed and Head of Bed Elevation. You will be given an incentive spirometer during your pre-operative assessment or during surgery school. We ask you to use this before you come into hospital to allow you to practice and have a good technique. We know this helps to reduce chest infections after surgery as it allows you to improve your lung function when you're not as mobile. We encourage you to use your incentive spirometer 4 times a day before you come into hospital and every 30 minutes after the surgery. Once you are more mobile, this can be reduced. Coughing after abdominal surgery can feel frightening. However, this is an important part in reducing the chance of you getting any post-operative pulmonary complications. Again, we should make sure your pain is well managed to allow you to cough, take deep breaths and mobilise. Oral health also plays an important role in preventing chest infections after surgery. We know at home you'll brush your teeth probably twice a day. However, when you come into hospital, your normal routine can be altered. This is why we prescribe it on your prescription chart whilst you're in hospital, just so it doesn't get missed. Just by watching this video today and by attending surgery school, you're improving your understanding of the Enhanced Recovery Programme. Therefore, you are taking an active role in your recovery and helping yourself recover sooner. Getting out of bed after your operation is very important. We know that early mobilisation and continuing to mobilise throughout your hospital stay reduces the chance of post-operative pulmonary complications such as chest infections. It helps to get the bowel returning to normal function, helps improve your lung function, and also reduces things like wind pain. We will help you get out of bed the morning after your surgery, and we will also help you mobilise. The aim is to build up to 60 metres 4 times a day, and the staff on the wards will support you in doing so. After your operation, we do just ask that you keep the head of your bed elevated slightly, as this helps to improve your lung function and helps your lungs inflate properly. It's also really important you sit out in your chair when able, and also mobilise whenever possible. Following your surgery, we usually allow you to eat and drink sooner rather than later. We know that good nutrition helps to support your wound healing and helps you to get up and about. We always suggest eating little and often. However, as good nutrition is so important, we also prescribe Ensure compact drinks. It's important you continue to drink these Ensure drinks even when you're allowed to eat and drink in hospital, as they provide extra nutrition to help aid your wound healing and help you recover sooner. Once you have returned home, it is important you stay active. We usually suggest doing a little bit more every day and trying to increase your activity levels, even if this just means going for a little walk outside or a walk around the house. We'll support you to remain active whilst you're in hospital, and we'll also support you and ideas of things you can do to keep active once you are home. After your surgery, you will more than likely have something called a patient-controlled analgesia pump. This allows you to give yourself painkillers when you need them. We always suggest you give yourself painkillers to help you cough, mobilise and take deep breaths. Deep breathing is when you use your incentive spirometer, and as we've mentioned previously, this is really important in your recovery. As soon as you're able to eat and drink, we usually discontinue the patient-controlled analgesia pump. You will then be given oral analgesia, or pain relief that you can take by mouth. This pain relief will be given as and when you require. Therefore, we suggest that you let staff know if you're having any pain or if you know that you need more pain relief to help you mobilise.
Hello, I'm Caroline, one of the stoma care nurses here, and you'll see one of our team before you go to surgery pre-operatively. That's normally about 2 weeks before surgery, so that we can go through what having a stoma is and where it's going to be placed pre-operatively and post-operatively. So initially what a stoma is, it's where they bring out a piece of bowel onto your abdominal wall. It's nice and it's rich red in colour, and it looks like a red tomato on your tummy. It's got no nerve endings in it at all, so you could touch it but you can't feel it. It feels like the inside of your mouth, really spongy to touch, but it's got no nerve endings in it. So when you physically look down onto your tummy, you'll see this red mark on your tummy. What we'll also help you to do is learn how to manage the stoma while you're in hospital, and we will see you Monday to Friday and teach you how to manage this on a daily basis. You'll be fully independent with your stoma management before you go home, and we'll show you how to manage this while you're in hospital. So to actually physically teach you how to manage the stoma, I'm going to show you what a stoma bag is, and show you how to physically take this off your tummy and put it on, and then show you how to attach your night drainage bag at night if you feel you want to have one overnight. So after we've had our discussion about stoma formation and stoma management, we actually have to mark you in preparation for surgery When we ask to mark you for surgery, we get you to first lie on the couch, and then we feel for the rectus muscle, which is the muscle that's right down onto covering your abdominal wall. We then get you to sit up. We then also get you to bend forwards. What we're looking for there is for any folds or creases that appear that might impact where the stoma is going to be originally positioned. We then get you to stand up so that you can physically see your stoma from a standing position, so that you're able to place the bag correctly in a standing position. And also we get you to sit back down again so you can also place the bag in a sitting position. Our aim is to, when we sight you for your stoma, that it is not visible under your clothing. On a daily basis, you will have to empty your pouch between 4 to 6 times in a 24-hour period. Because if the pouch gets too full, you then have a possibility of it leaking. So we teach you how to learn to manage this. So you'll find out how much you're drinking in order to how often you'll need to empty your pouch. This is how the pouch will sit on the right-hand side of your tummy, and this will then fill with urine. When it is about a third full, we then advise you to then go to the bathroom to empty the contents into the toilet. This is done by just undoing the bottom and emptying it into the toilet, drying with some toilet roll and putting the fastener back in. So the actual pouch itself can be changed either daily or every other day, depending on how that will fit into your general routine. So to actually apply the pouch to your tummy, what you have to do is there's a plastic fastening on the back, which you then pull off. This bit is very, very sticky, and once it sticks to the warmth of your tummy, it will stay. When it comes to time to remove your pouch, we'll also provide you with some adhesive remover to help you do this. Before you leave hospital, we'll make sure that you're fully comfortable in looking after your stoma before you go home. Once you go home, you'll be followed up by the stoma care team in the community, and you'll have all their contact details if they have any problems or concerns. But you can also contact us, the stoma team at Stepping Hill here, if you've got any problems or concerns, and we'll give you all those contact details on discharge from hospital.